Hello and welcome to the presentation on chronic pain or joint pain, and I hope this is helpful and empowering for you. Let's get into it. A lot of basic things you can do at home without the need for the doctor. For example, healthy diet is usually the first thing I'm recommending for my patients with chronic joint pain. In particular, you want to focus on a whole food, plant-forward diet, a low inflammatory diet, an anti-inflammatory diet. Think Mediterranean or pescatarian. Decreasing protein sounds like it goes against conventional advice, but it's true. Multiple studies show that the more protein you intake, the higher the inflammatory levels in your body, especially with animal proteins, which are more acidic. So focus on limiting protein in your life. Don't worry, protein deficiency is extremely rare. Protein overabundance is all around us. Eliminating milk and butter is important for the same reason. Focus on fortified nut milks like soy milk, dark green leafy vegetables. These are excellent calcium sources. Eliminate highly processed fats and oils, your vegetable oils and shortening, etc. Eliminate trans fatty acids such as fried foods and use healthy fats like olive oil, walnuts, ground up flaxseed. Healthy sources of omega-3s, I just mentioned, there they are again. Ginger and turmeric are well studied, and in the next slide, I believe, out of India, focusing on knee joint pain, they took curcumin, which is the active component of turmeric, and in dosages of 500 milligrams 3 times a day achieved superior results without any side effects when compared to prescription diclofenac. You can purchase curcumin at your local supplement store or online. For those so inclined, cannabis is getting a lot of attention, and perhaps Dr. Abrams from UC San Francisco has done the best work on high CBD content, inhaled cannabis. CBD is the pain-relieving component of cannabis, THC the psychoactive component, so you really want to minimize the THC. But a high CBD vaporized cannabis can be helpful for a lot of people with joint pain. Of note, I don't recommend it in those under the age of 30. Very interesting work coming out showing that cholesterol not only circulates through our blood, but also accumulates in the synovial fluid of our joints and can lead to pain. So there was a study done on patients on statin drugs. This can cut both ways. Some patients, maybe 5%, get a lot of joint pain from the statin drug, but just as many patients have less joint pain on the statin drug because of the removal of cholesterol from the synovial fluid. Cognitive therapy is important, and this is important to phrase correctly. This is not to say the pain is in your mind, but the pain is kind of in your mind. Without a brain, you feel no pain. So altering how you receive those impulses from your peripheral nerves where the pain originated can be invaluable. This is kind of a shift in mindset, and it works. So don't discount your doctor or provider if they are recommending therapy to deal with chronic pain. It can be life-saving. In that respect, here is a online cognitive behavioral therapy link that you can try out, and some books to finish out the presentation. Opiates are pretty risky and don't work for a lot of people, so this book discusses how to get pain relief without opioids. Here's another book, Less Pain, Fewer Pills, Avoid the Dangers of Prescription Opioids and Gain Control Over Chronic Pain. Here's another one, Managing Pain Before It Manages You. So this guides patients with chronic pain to really identify patterns in what causes their pain and what relieves their pain, and this can be helpful for a lot of patients. Full Catastrophe Living, Using the Wisdom of Your Body and Mind to Face Stress, Pain, and Illness by the great Jon Kabat-Zinn. So this might be the most important book of all. I am a firm believer in the power of mind over body, resilience. Build a strong mind, and it will help to strengthen the body. Unlearn Your Pain by Howard Schubiner. So this book demonstrates that the underlying reason for much chronic pain is nerve sensitization and learned pathways. These can be unlearned, and he discusses how in his book. This concludes the joint pain or chronic pain presentation. I hope it was helpful and empowering. Good luck to you on your journey. And if you have any questions, feel free to message me through the portal or set up a visit in the office or by telemedicine. And good luck.